again, it's my very great pleasure to introduce our first speaker, Professor Sir Michael Marmot, who's going to be speaking about building back fairer. Sir Michael is currently Director of the University College London Institute of Health Equity. Amongst many distinguished roles, he's advisor to the WHO Director on the Social Determinants of Health, and he's the author of many publications, including The Health Gap, which has been hugely influential and very particularly important for the discussions today. I'm not going to go on, there's so much more to say, but I don't want to eat into your 25 minutes, Professor Marmot. What I would just say before handing over to you is that after your contribution, there'll be an opportunity for questions and comments and discussion. So please put these in the chat, that way we can group them and get the most out of the discussion. Okay, so thanks for that. So over to you, Professor Marmot. I'm very much looking forward to hearing what you've got to say, and a very warm welcome.
Thank you. And it's a pleasure to do this. I've taken the title, Dialogues in Democracy, seriously. I'm not going to talk about adult education per se, but the question commonly that I get asked is, your evidence is so compelling, why don't governments act on it? And my response in a way is, it's a problem with our democracy. And the other thing to say before I begin, which in a way is the summary of my presentation, that I start from the assumption that the level of health of a population tells us a great deal about how well that society is meeting the needs of its members. And health inequalities tells us a great deal about inequalities in society. In other words, it's not just about the healthcare system. The opening line of my book, The Health Gap, which was just mentioned, was why treat people and send them back to the conditions that made them sick. Particularly during and after a pandemic, we think a great deal about the healthcare system. My abiding concern is with the conditions that make people sick, the social determinants of health. And we see it this way. If you classify people by where they live, classify where they live by the index of multiple deprivation, this is life expectancy. Now, when we think of health inequalities, commonly we think about poor health for the poor. And indeed, the most deprived do have poor health, much poorer than everybody else. But people in the middle have shorter life expectancy than those near the top. In fact, those near the top have shorter life expectancy than those at the very top. For women and for men, it runs all the way from top to bottom. The problem that we seek to address is not just poor health for the poor, but inequalities in health, the social gradient that runs across the whole of society. In February 2020, just before the pandemic crashed upon us, my colleagues and I produced Health Equity in England, the Marmot Review 10 years on. We looked back to our 2010 publication, Marmot Review, Fair Society, Healthy Lives, and asked what had happened in the decade after 2010. Life expectancy had been increasing about 1 year every 4 years for women and for men. This is 1980. And in 2010, there was a break in the curve. The rate of improvement slowed dramatically and just about ground to a halt. And that slowdown was more marked in England and the United Kingdom than in any other rich country except Iceland and the United States. And if we look at inequalities, this is women. For women in the least deprived 10%, the regional differences are quite small. If you're rich, it doesn't matter much in which part of the country you live. Small regional differences and improvement modest improvement in life expectancy. For the most deprived, it matters enormously where you live. Much bigger regional differences. Life expectancy was going up in London, but pretty well going down in every region outside London. This is where we were pre-pandemic. Health had stopped improving, inequalities in health were increasing, and life expectancy for the poorest people was going down. Wow. I had 6 domains of recommendations in the 2010 review. Give every child the best start in life, education and lifelong learning, fair employment and good work for all, highly relevant today. Everybody in a rich society should have at least the minimum income necessary for a healthy life. Healthy and sustainable places and communities in which to live and work, and taking a social determinants approach to prevention. What happened post-2010? The government had a stated ambition to reduce public expenditure, to roll back the state, austerity. And by golly, they did it. In 2009-10, public expenditure was 42% of GDP. By 2018-19, that 42% had become 35%. We were in the middle of the European range in 2009-10. We're at the bottom, near the bottom of the European range at the end of the decade. In my 2010 report, I coined the rather awkward phrase proportionate universalism. I was trying to combine a Nordic approach to social policy, universalist solutions, with a classic British approach, which is target the worst off. So I said, what we want is universalist approaches with effort proportionate to need. We could even call it leveling up. So social distribution, less deprivation, longer life expectancy, for example, better health, there's the gradient. We want universalist programs with effort proportionate to need. The greater the deprivation, the greater the need. What did we get post-2010? This is spending by local government per person after 2010 in the decade by level of deprivation. In the least deprived 20% of areas, the spending per person went down by 16%. And then the greater the deprivation, the greater the reduction. In the most deprived 20%, the spending per person went down by 32%. What we've got here is effort inversely proportionate to need. The greater the deprivation, the greater the need, the greater the need, the greater the reduction in spending. Could this have played a role in the slowdown in improvement in life expectancy, the increase in inequalities, the decline in life expectancy in poorer areas? Yeah, I think it could. Let's take one of my recommendations, early childhood. Child poverty is defined as being at less than 60% median income. Here's child poverty in 2010-11, 17% before housing costs, 27% after housing costs. Housing's a big contributor. And that 27% became 30%. Child poverty went up. That's quite an achievement. How did they do that? These are changes in net household incomes due to tax and benefit reforms after 2010 by income. So let's look at working age families with children. If you were in the poorest 10% of household income, your income would have gone down by 20% as a result of the Chancellor's changes to taxes and benefits. If you were in the second poorest decile, it would have gone down by 12%, and then the richer you were, the less the reduction. some reduction at the top level, but the percent reduction is nowhere near as big as it is lower down. Government's policy was to make poor people poorer. Then came the pandemic. We produced this report, Build Back Fairer, at the end of 2020. The idea being that the pandemic exposed and amplified the underlying inequalities in society, and we should take heed of what we learned during the pandemic and not simply seek to reestablish the status quo, but to build back fairer. This is what I mean. The dark green is the social gradient in all-cause mortality by level of deprivation, the index of multiple deprivation, and the pale green is COVID-19. Almost parallel graphs. The social gradient in COVID-19 looks very much like the social gradient in all-cause mortality. Yes, we have to control the virus, but we need to deal with the underlying social inequalities that give rise to the social gradient. That's what I showed you before. And this was the impact of mismanaging the pandemic. Life expectancy dropped sharply in 2020 by at least a year. ONS published this a couple of weeks ago, looking at life expectancy in 2018 to 20 compared with the previous 3 years. So a lot of it is influenced by what happened in the pandemic 2020. And there you see life expectancy fell, not just for the most deprived 10%, but for the bottom 4 deciles, for females and males. For females, they did okay for the top 6 deciles. The men didn't do very well anywhere, but this regressive decline. Wow. And healthy life expectancy shows even bigger inequalities. So if we look at women, this is again from the recent ONS report, there's the gradient in life expectancy, but this is life spent in poor health. Women living in the most deprived areas of England expected to live 1/3 of their lives in poor general health. So they have shorter lives and have more years of those shorter lives in ill health. So the gradient for healthy life expectancy is much steeper than the gradient for life expectancy. I said we managed the pandemic badly. Here's the evidence, a recent publication from the US. Life expectancy in 2019, 2020, 21 in the United States. There's Scotland, Northern Ireland, Germany, England, and Wales. It wasn't necessary to have this big fall in life expectancy. Sweden didn't, Korea didn't, Norway didn't, Sweden didn't, to Switzerland didn't, Sweden, Spain, Italy, France, Finland, New Zealand. We did really badly. We managed the pandemic appallingly. I want us to build back fairer. We've got to change these things. This is from the OECD Family Database. Total public spending in early childhood, education and care. In Norway, they spend over $12,000 per child. Sweden, a bit under $12,000. The OECD average is around $6,000 per child, and we spend less than the average, closer to $4,000. Not the very worst. The United States is always worse than we are at everything, but worse than average, limping along, not very good, worse than average. Our management of the pandemic, worse than average. Our improvement in life expectancy pre-pandemic, worse than average. Not as bad as the US, but pretty bad. Wow. Is that where we're happy to be? Look at child poverty. Iceland, Czech, Denmark, Finland, Korea. Child poverty at 10, 11%. Here's the United Kingdom. Worse than average. And there's the United States. This isn't great. Household poverty in 3 outcomes. These are from PISA scores, the Program of International Student Assessment. So the number of points in time between infancy and age 14 when a child lived in poverty and low word score at 14, the more times people were in poverty, the less well they performed on PISA scores, the more likely they were to be obese, the more likely they were to be depressed. And what have we been doing with education spending? Real terms, changes in per pupil funding by deprivation, 2015-16. So we cut funding, but we cut it more in deprived areas. I was on Times Radio this morning talking about the cost of living crisis, and Ian Duncan Smith was on before me. He said 9 times in a 3-minute interview, we've got to cut taxes. Why? Does he want to reduce spending on education even further? Does he think that's a good thing to do? Even when we started spending on education in 2020-21, we spent more in the more privileged areas than in the more deprived areas. Air pollution, PM 2.5 levels, children living in poverty. There's a clear correlation. And then we come to the current cost of living crisis, which I described as a humanitarian calamity. Now, during 2020, with the furlough scheme, these are data from the Resolution Foundation and other interventions. Wow, the poorest had a bigger increase in household disposable income after housing costs than the richest. That really is reversing the trend. But 2021-22, normal services resumed. The poorest get the biggest drop. And it's very neat gradient. The poorer you are, the bigger the reduction in income. I mean, look what's happened. This is universal credit in real terms. The £20 uplift, £1,040 a year, slowly eroding because of inflation. And then universal credit uplift was withdrawn. 200,000 more children thrown into poverty. Then failing to uprate universal credit in line with inflation means that here in the first quarter of 2023, universal credit will be 8.6% below the first quarter of 2020 and 17% below the third quarter of 2021 with the upgrade. If you're poor, by golly, it's government policy to make you poorer. Look at what that means. This is from the Resolution Foundation. A single person with 1 child working 20 hours, sorry, it's not the child working 20 hours a week, single person working 20 hours a week at a low to median wage. Let's say this parent has an annual income in September 2021 of £18,265. She will lose £1,040 because of removal of the boost to university credit, universal credit. They'll lose £1,200 because of the cost of living increase. They'll gain some because of tax and benefit and whatever changes and salary increases. The net effect will be a reduction of £584 a week. If you're at the margin, just about at the definition of poverty, and you lose £584 a year, sorry, not a week, £584 a year, £11 a week. That's huge. That's huge. Never mind heating or eating, you can't do either. And if the calamity happens, if a child needs a new pair of trainers, forget it. But we have Levelling Up. The Levelling Up white paper, 330 pages. The first part, the analysis, is brilliant. And it has 4 objectives, 12 missions, terrific analysis. And the white paper refers to the example of Germany. When the former communist country of Eastern Germany was incorporated into the Federal Republic, Germany leveled up. They spent 2 trillion euros over 25 years, which is about 70 billion pounds a year. Did it work? Well, here's life expectancy for women in East Germany and West Germany. Reunification. Wow, they closed the gap. Men, well, they didn't quite close the gap, but they made real progress. Spend real money, you can make real progress. But the Levelling Up budget in the white paper for 4 years in England is 4.8 billion, 1.2 billion a year compared to 70 billion a year in Germany. IPPR North said the 2021 allocation of the Levelling Up Fund was £32 per person, whereas the drop in annual council service spending was £413. So you take £413 per person away and you give 32 back and you say, great, now we're levelling up. When Ian Duncan Smith said 9 times, we've got to cut taxes, he didn't mention levelling up. He didn't mention how that was going to be funded. Pretty grim. We're working with localities right across the country, and that's really positive. Coventry, Greater Manchester, Luton, Waltham Forest, Cheshire, Merseyside, Lancashire and Cumbria, Leeds, north of Tyne, Gwent. Coventry declared itself a Marmot city and took my 6 domains of recommendations and applied them. Local government, integrated care systems as they are now, voluntary and community sector. We did a report for Greater Manchester, Build Back Fair in Greater Manchester, and now we're trying to get industry involved. And last month we published The Business of Health Equity, the Marmot Review for Industry. And we said there are 3 areas where industry can play a role. Provide good quality work. Every employer should pay the real living wage. Pay attention to benefits, conditions, hours. We have a very tight labor market now. Now's a very good time for employers to say, if we want to attract and keep quality people, we have to pay a real living wage and provide good working conditions. Products and services. Stop damaging people's health by selling them unhealthy products. And the wider impact on the community and the environment. To our 6 principles of action, we've added 2. So we've still got give every child the best start in life, education and lifelong learning, fair employment and good work for all, having enough money to live on, healthy and sustainable places, communities, and taking a social determinants approach to prevention. We've added tackle discrimination, racism, and their outcomes, and pursue environmental sustainability and health equity together. We had poor health pre-pandemic, and then we managed the pandemic really badly. Remember, I began my talk by saying, I think of health as a measure of societal success. So in addition to my specific recommendations, we have to deal with poor governance and political culture, with the increasing social and economic inequalities, with reduction in spending on public services. We were ill-prepared coming into the pandemic, and the fact we weren't very healthy. My overall recommendation is to put a fair distribution of health and well-being at the heart of all government policy. Thank you.